Hello and welcome back. Again today I'm joined by the physicians from Albany Urology. I'm now joined by Dr. Scott Wendland, board certified physician at Albany Urology. Thank you for joining me today.
Glad to be here.
You know, today we're talking mostly about issues that concern men in the male population. We've talked about prostate cancer and low testosterone, but another common thing we hear is BPH. Talk to me a little bit about that.
Yeah, BPH, as you said, is very common, probably the most common problem that we see in men. It's a problem. The prostate is a men's sexual organ, and it kind of sits right at the neck of the bladder, and it can enlarge and cause obstruction and a lot of difficulty voiding symptoms associated with it. Okay, so obviously if it's common, people may be experiencing some symptoms and might not realize that's what it is. Talk to me about the symptoms. Well, sure, symptoms are very common, and a lot of people just attribute it to I'm just getting older and I just got to deal with it, but it isn't. They say half of men by the age of 60 and 90% of men by the age of 85 are affected by some symptoms or the other. So if you live long enough, you're going to have problems with BPH. You know, the symptoms start with what we call obstruction. Again, I said the prostate sits and the urethra runs through it. Okay. And as it enlarges, it constricts the flow of urine. So people, have a little bit of dribbling, they have a slow stream, it starts and stops, it takes a little longer at a urinal, that's what men will often notice. Right. And then it often progresses to what we call the irritative or the bothersome symptoms, and that's the frequency, urgency, you have to rush to the bathroom, you can't hold it, and get up at night, all these things that keep people from doing what they want to do. Okay, and now how do you screen for that? Mainly by symptoms. Okay. People will say, they'll come, we have a standardized set of questions that we ask that have been validated, and all those symptoms that we talked about, how frequently you have problems with slow flow, getting up at night, frequency, urgency, etc. Okay, and once you've identified a patient that has this, what are their treatment options? Well, like anything, there's a whole gamut. You can do, sometimes we'll just watch it. When people know what's going on, they can understand it and deal with it. There are some herbal or supplements that people can take that may offer some benefits. Probably most commonly we start with medications. There's two different types of medicines that we can give. One that sort of relaxes the prostate and the bladder neck and works rather quickly. One that will shrink the prostate a little bit. It takes several months to kick in, but sometimes we use a combination of the two, and that will help. And then there is a newer treatment out that we can talk about a little bit that talks about some of the new way that we can treat it. And then there's the traditional ones that people have heard of. The TURP, a lot of people call it the old Roto-Rooter, basically a crude way of saying you open up the prostate so that people can urinate better. We do that with electrocautery or cutting. Okay. We do it with lasers. In some cases, in extreme cases, we can even do open surgery to remove part of the prostate in very, very large glands. And typically when they find this treatment, you probably base it off their symptoms and how they're responsive to what you're trying. Right, and we talk about different options. We're not going to jump to one end of the spectrum. It's usually a continuum of things that we offer people. But eventually they can get back maybe to a lifestyle. We've been talking about that in the show today, and how people avoid and doing events and things that changes their lifestyle because of problems like this. Yeah, absolutely. So now let's talk about the newest treatment option. You mentioned the UroLift. Tell me about that. Well, UroLift is a new procedure that we've recently started doing here. It's been available for a long time. Okay. We've got good data out 7 years now in the United States and more than 10 years overseas, and it's kind of a bridge, often can be used as a bridge between medications and behavioral therapy to men that really don't want to go that extra step to the cutting. There's no cutting of tissue or ablating of tissue, so you don't have as many of the side effects. So there are often some sexual side effects, more risk of bleeding and other things with the traditional operation. So it fills a great void in a space that we haven't had anything before. And sometimes men can't take the medicine. Either they're too expensive, there's too many side effects, or we just don't like taking medicine every day. And a lot of men are of the opinion if we know what's wrong and we got something that will fix the problem, let's fix it. Let's not just throw medicines at it. That's right. So tell me about now the actual procedure itself. Well, the prostate, as I said, kind of is a gland that sits at the bladder neck. The urethra runs through it. So as it enlarges, it constricts it. The UroLift is a device that we place without any cutting or ablation of tissue. We have a camera, we go look into the prostate, and it has a suture that will actually open up the prostate. I say it's almost like pulling curtains. On each side, it spreads it open and allows people to open up the channel and help almost immediately with the obstructive symptoms, and then pretty soon thereafter the other irritative, the burning, frequency, urgency symptoms get better as well. Okay, now is this something you do there at your surgical center? Yes, yeah, we do it right in our office at our surgery center. We do give an anesthetic for it, so there's no pain associated with the procedure. Right. It's a very quick recovery. You have a little bit of discomfort for a few days, but men can be back to doing whatever they want to do, usually within a week or two. And it's just minimally invasive, like you said, and just kind of
the benefits outweigh
Yeah,
dealing with the problems.
It's a great procedure. There hasn't been anything new that's really caught our attention like this procedure in quite some time. We're very excited, and patients are very excited about how quick they get better.
Sounds like a great option. So let's go again. Like, who's the candidate for this? Is it somebody probably that's failed on medication
It's
therapy?
someone that, we put people through a pretty rigorous screening profile to see if they're a candidate, because we don't want you to have the procedure if you don't need it, and we want to make sure it's going to work. And when we follow this, we know it does work. We look at a certain size prostate will work, and certain anatomy of the prostate will work. And then you have the symptoms that we talked about. You have difficulty voiding. We'll often do some specialized tests where we actually have men urinate in a special machine or a container that will tell us the flow of their urine to make sure that they really do have obstructive symptoms. And once you go through that, if you meet all these criteria and you have no other significant medical problems that would preclude you from doing something like this, you're a candidate and can do real well with it.
And talk to me a little bit, you mentioned another procedure. This is way more, it sounds like this is a much easier procedure.
Yes, yes.
So it definitely outweighs the benefits of doing this versus the old traditional way?
The traditional way, and there's still a role certainly for the TURP, we call it, to trim out the prostate. It's just a lot quicker recovery. In a traditional TURP, most people are in the hospital a day or two afterwards, and a lot higher risk of bleeding, a lot more side effects down the road. It works. It's a great operation for men that need it, but maybe you don't quite need all that.
Right.
And if you have this procedure, there's nothing to say 5, 10, 15 years down the road you can't still do something else to the prostate, but it kind of gives you more time.
Do they see kind of immediate benefits or like results?
Yeah.
Talk to me about that.
Almost immediately. Like I said, there's some irritative symptoms the first few days, but the flow improves almost immediately. There's a little swelling that goes on for a couple of weeks afterwards, but it's been really remarkable. Men have been real happy with it.
Any follow-up care they have to do after that, or once they've kind of healed from it?
Once they've healed from it, it's just a routine health screening that was been talked about a little bit earlier this afternoon.
So again, we want to push men to go to the doctors.
Right.
And Dr. Daugherty touched on this earlier, but I want to talk about it again. Often the male population has a hard time forthcoming with the issues they have. So I'm asking, what's your advice to
Sure.
them?
I mean, people, it's not just about getting old.
Right.
If you're having problems, there are relatively easy ways that we can fix most of these issues. Two, it's not about you have to be the tough guy and just take it either. There's plenty of things that we can offer men that give them immediate benefits. It's going to help your quality of life. It's going to make everything go a lot easier for you.
Right. And again, at your practice, you have a full surgical center. Tell me a little bit about that.
Right. Everything we can do right in-house. With urology especially, there's always some privacy issues. You don't want to be in a big hospital with hundreds of people everywhere.
Right.
We try to be discreet. We have a small staff, and this is all we do, and that's all our nurses do. That's all of our staff does, and we're aware of all the ins and outs of the practice.
Right, and this is what you treat every day,
That's right.
in and out. And so I've been making sure we reiterate to men, it's just another day at the office for y'all.
That's
so
right.
not to be embarrassed.
Absolutely not. I say it's like looking at an elbow.
That's right. Same thing. Now, what about, we talked about getting the men to go to the doctor and talk about their concerns, but what about those men who may not have a doctor? Are they able to call your office and get an appointment?
Sure. Very, very rarely does anybody need a referral to come in and see us. Of course, we obviously take referrals, and we encourage you to go through your primary care physician, but you can call our office at 229-883-1503 and make an appointment to see any of us. We can also be reached by email and through the website as well.
Okay, and again, we want to remind them that it's just most of these disease states we've talked about can sometimes be prevented with early prevention screenings. It's very important.
Yeah, like anything else, if you catch it early, it's much easier to deal with. You don't want to wait till it causes significant problems, and we have to deal with those.
And the majority of those screenings you do there in your office.
Absolutely, we do
like
it
I
all
said.
under one roof.
That's right. Well, we're going to get these guys to you and let everybody get checked out.
Great.
Thank you for your time and being here today.
All right, my pleasure.
Thank you for watching Healthcare Today. And again, if you'd like more information from any of the physicians that you saw here today, you can visit the website below. Again, it's Albany Urology, located here in Albany, Georgia. Thank you, and we'll see you next time here on Healthcare Today.